First, can I have you introduce yourself?
I'm Julie Woodyard. I'm the Executive Director of Crescent Community Health Center here in Dubuque.
Right. What are some of, the top concerns that Crescent has with regard to the American Health Care Act, the House passed healthcare law or healthcare bill?
Well, the House passed bill would eliminate many people from health insurance, not only subsidies, but coverage in general. That's our first concern as community health centers. Along with that, that pullback of the Medicaid expansion by most states, not all, but most, would really hurt us in Iowa. Community health centers, the majority of patients in health centers in Iowa are covered by Medicaid. In our situation here, our patients are covered by Iowa, Illinois, and Wisconsin Medicaid. So that's a huge percentage of people. And so that would distinctly hurt our financial position with respect to Medicaid being our largest payer. The second issue is prior to the end of the federal fiscal year, Congress needs to reapprove the financing for health centers, which means our federal 330 grant, which Crescent receives about $1.3 million this year of our $6 million budget. So that's quite a chunk that's at risk. We could lose up to 70% of that funding. Now, all of that funding we use for our personnel expenses. It doesn't nearly cover all of our personnel expenses, but it helps us to afford to bring some services to patients that we normally wouldn't be able to do. For example, an anticoagulation clinic, pharmacists helping, consulting with our providers and educating our patients about their medications, doing medication management, which is really important, doing care coordination to make sure that our primary care providers know what's going on if our patients are hospitalized or referred out for specialty care or in the emergency department for care. Those transitions of care are extremely important, and if the primary care physician doesn't know what's going on, that could mean trouble down the road for the patient if that communication isn't there. So September 30th is a big date, and also whatever the Senate's going to do with, the health care bill that the House passed. If they start over again, we'd really like to have some input into those discussions. Prior to this, there has been no input of health centers, or really, I'm not sure if anyone else has had any input either, but we have, as health centers, been advocating for Congress to meet or exceed that deadline of September 30th for funding for our 330 grant, also the National Health Service Corps loan repayment program. Many of our providers are eligible for that loan repayment, and so that's one of the ways in which health centers can attract, brand new providers or providers to staff our community health centers. That was taken out of that bill, so it's extremely important for us to be able to have that carrot to bring providers here, and also the Medicaid expansion to keep that going. So those are the three big things.